At Asherman Therapy, we have developed an innovative cell-based therapy called PAULA to support women affected by Asherman Syndrome and endometrial atrophy. Asherman Syndrome is a condition where scar tissue forms inside the uterus, often after surgical procedures like dilation and curettage. These adhesions can prevent the normal regeneration of the endometrial lining, which is essential for healthy menstrual cycles and fertility. In many cases, this condition is associated with endometrial atrophy, where the endometrial tissue becomes thin and loses its functional capacity. To address the impact of Asherman Syndrome and endometrial atrophy, we've created PAULA, an advanced therapy that uses autologous CD133 plus bone marrow-derived stem cells to regenerate damaged endometrial tissue, restore function, and potentially reverse infertility. The PAULA therapy process involves the following steps. Step 1. Patient evaluation. The journey begins with a thorough evaluation using diagnostic hysteroscopy to confirm Asherman Syndrome and assess its severity, including any endometrial atrophy present in the uterine lining. Step 2. Mobilization and apheresis. The patient is treated with granulocyte colony stimulating factor to mobilize bone marrow-derived stem cells into the bloodstream. Apheresis is then performed to collect these cells. Step 3. CD133 plus isolation. The collected stem cells are processed in a good manufacturing practice, certified laboratory to isolate and enrich the CD133 plus cell fraction. This ensures only high-quality viable cells are used for the next step. Step 4. Stem cell infusion. The enriched CD133 plus stem cells are infused into the uterine arteries via catheterization. This targeted delivery promotes regeneration of the endometrial lining, including restoration of thickness in cases of endometrial atrophy. Step 5. Follow-up. After the infusion, the patient's progress is monitored using hysteroscopy and ultrasound to evaluate endometrial recovery and the therapy's effectiveness. The patient is then referred back to her fertility center to pursue pregnancy through natural conception or assisted reproductive technologies. PAULA has shown promising results in early clinical trials, improving endometrial regeneration in women with Asherman syndrome and endometrial atrophy. For more information or to learn how PAULA can help, visit us at ashermantherapy.com or contact us at inquiries@ashermantherapy.com.